Although it's the #1 killer year-round, repeated studies show a spike in heart attacks on Christmas Day, the day after, and New Year's Day. All that's coming up. Prevention is the goal, but if you have a heart attack, successful surgery or other intervention is just part of the process. The real recovery, the part that gets you back to walking, breathing, and living your life again, happens after you get home. Our first guest can help you do that. Modern Heart and Vascular's Cardiac Rehab Director, Beth Horton, is here to explain how this intensive program helps patients heal and stay heart healthy long term. Good morning.
Good morning.
All right. This is something that you have experienced in your own life, and that's what kind of guided you into what your career is today. Your grandpa went through a cardiac rehab.
Three, actually.
Three of them. Wow. Okay.
Yes, he's had heart attack, stent, valve. Two valves actually, one in the other. And then my stepfather, he also had a valve replacement, and so it's. That's really what got me into cardiac rehab, because I was going down the physical therapy track, but I really got interested in that when I saw the role that it played and the support that it has.
Yeah. What did you see that sparked your? Because that's the part that we don't see. We always hear, Bob had a heart attack and Bob's now fine, right?
Well,
we don't see
it's
the
a
in
huge
between.
thing to happen to a person. You don't realize the mental aspect that it takes on you. And if something happens to your knee, you do physical therapy, right? They don't realize that there's another thing to do if you have a heart event or heart surgery. And so I saw the support that it gave them in that time of a lot of mental strife, and so that's what really got me interested in it, and I never looked back.
Yeah, and then also, you're right, the education piece, as opposed to being told, okay, so we saved you from the heart attack right now go home and do better. Or what does do better mean?
Yeah, ABCD, this is what I want you to do.
Yeah, we'll get to that in just a second. But, a lot of people still don't realize that heart disease is the #1 cause of death of men and women around the world. I say men and women because a lot of times people will say, well, that's mostly a men's. No, it's not.
Correct.
And oftentimes the first symptom of a heart attack is the actual heart attack itself until hindsight's 20/20. All right, at Modern Heart and Vascular, I know one of the biggest things you all would like to focus on is prevention. You can actually have those scans where you can see somebody and see if a heart attack is coming.
Yes, well, and there's lots of different tests that they can do to find out what's going on. Some of them are obvious and some of them are not. But again, modern is all about prevention. And so sometimes even if after you have an intervention, you have a surgery of any kind, our role is to help you recover from that and teach you how to prevent anything else, diabetes, high cholesterol. Even if you have those things, hopefully we can get them under control and prevent another heart event from happening.
But by the way, those are some of the risk factors.
Oh,
so
absolutely.
when you go into Modern Heart and Vascular, they will check you for those things, calcium buildup, high blood pressure, cholesterol, all body weight, all of those things. But don't rely on those things, because there are other people who've had heart attacks or heart issues who didn't necessarily have those situations or even family history.
Or symptoms.
Yeah, or symptoms, that's right. Okay, recommendations, lifestyle changes, possible medications, other procedures. However, we know that thousands, millions of heart attacks happen anyway. So surviving one, many don't know about the path to safer healing, which we touched on earlier. And so that's intensive cardiac rehab. It can reduce the risk of future heart problems as well. So let's talk about what the intensive cardiac rehab is, medically supervised, of course.
Yes, so you have your cardiac rehab programs, and they're all monitored and progressive exercise therapy programs. But what makes intensive cardiac rehab different is every time you come to cardiac rehab, you get education. So it's over exercise, how to do it safely, balance and fall prevention now and in the future. And you have the nutrition component, where we do cooking workshops every week. We teach you how to do things like label reading and how to read a menu appropriately, especially in Texas. It's really hard to eat heart healthy. And
we just had Thanksgiving,
Yeah.
Extra
so
stuffing,
this is,
please.
it's like Happy Monday after Thanksgiving, here we go, talking heart healthy.
Yeah.
But it really teaches you how to do that and makes it a lot easier on you and doesn't make it as overwhelming, because your doctor's going to recommend that you do all these things anyway.
Yeah.
So we try to teach you in a way that you can do it and you're independent and you don't feel like you have to rely on all of your healthcare providers.
When you say that's not so overwhelming, because if you're given everything at once, you're not going to remember it all. I mean, people are still trying to recover from what happened, right? I just want to point out, too, that most insurance covers about 36 visits. So
36 visits.
That can help you relieve some of the stress, which we know stress is one of the problems as well.
Gives you a little bit of education every time you come.
Yeah, you also have a full video series for at-home learning to make it more convenient.
Yes. Absolutely.
Right. And you celebrate graduates at the end of the program, because it is a process, and so you get to graduate if you've gone through the...
It's a big deal. I mean, it's 36 visits. It's 12 to 18 weeks. Of course we're going to make it a big deal. Cap and gowns. I even made when we moved into the new building, I made a huge streamer wall. They get a certificate. We have like a grad bag. I mean, it's a big deal. And so I love to celebrate them. And we try and make these people feel comfortable and well supported, and to make sure that they know that they're, we're celebrating them after they've done this big thing and they've made it through. When a lot of people, they come in and they don't see another side. They don't realize that you have a heart event and you can live a normal life. You can be healthier than you ever were.
Yeah.
And
if we only knew today, or knew then what we know today.
Right.
How many people come in, and because everything you're teaching for the most part is how we should all be living anyway, right?
Yeah.
How many people say they're surprised to find out certain things?
Very surprising. I think the biggest thing for me is they don't realize that a temporary bout of anxiety, depression is normal after a heart event. It's a big life event to happen,
Right.
and a lot of people don't expect it. And so if you feel anxious or depressed, or you just very uncertain after a heart event, it's normal. And that's where we come in as well. We have a whole segment where we talk about healthy mindset and how stress and anxiety and depression play a role into heart health.
Yeah.
And so we talk about that as well.
Yeah. All right. The heart is a muscle. The body is very forgiving for a long time, but so if you just give it a chance, it'll treat you well. All right. Modern Heart and Vascular, you're different because you're Houston's only intensive cardiac rehab program. So
right.
that's pretty interesting because, again, like I mentioned before, I know several friends who've gone through programs, and it's like they kind of got shoved a envelope full of papers, and it's like, okay, do better.
Yep. And
that was it. And so you can tell the difference in what the long-term impact will be based on research backed by the Pritikin Lifestyle Program, one of a few medically approved ICR models that are around. All right, designed for a long-term lifestyle change, and you make it easy for people. All right, it's the body's most important muscle. The rest of the body certainly depends on it.
It does.
But early signs that you should probably make an appointment to at least get checked.
I mean, it's different for everybody. I would say there's usually those certain ages that you probably need to establish care in general and just get kind of a wellness check. It's different for everybody. There's some obvious signs, like the heart attack and the chest pain, and the pain that radiates.
Tightness and all that
for
stuff,
some
yeah, out of
people,
breath.
it's indigestion, it's extreme fatigue, it's out of breath. For some women, it could be abdomen pain or middle or lower back pain.
Yeah. And women may present differently than men.
Correct.
Too.
Sometimes, yes.
All right. So the key thing is make sure you get your physicals and get checked up so you know where you stand.
Right. Anything abnormal, check with your doctor.
Thank you very much.
Absolutely. Thank you for having us.
Modern Heart and Vascular offers the only intensive cardiac rehab program in the Houston area, as we mentioned, and it's located in Humble. To see if you qualify, visit modernheartandvascular.com or call 832-644-8930. Again, that's 832-644-8930.